Ladies and gentlemen, can you please take our seats? The Honorable Minister of Health, Dr. Demby, Minister of Information and Civic Education, Honorable Chenor, with your kind permission, I would like to call this meeting to order. Ladies and gentlemen, good morning. This meeting is now.
No, they sit down.
Please can we take our seats? Thank you. I would like us to stand for a minute of silent reflection.
They sit down. They sit down.
Amen. Amen. Good morning, all. Today we are gathered here to witness historic event in the Ministry of Health. But for us to have a detailed information about this particular event, I would like to call my colleague, Bella Samba, to tell us more why we're here.
Good morning, all. The Honourable Minister of Health, Dr. Demby, the Honourable Minister of Information and Civic Education, Honourable Chenor, distinguished members of the High Table, and which senior management team, members of the civil society and health development partners, my colleagues in the media, ladies and gentlemen, good morning once again. We're here today for a very important event. In fact, this is the very first time that the Ministry of Health is having such an event, a town hall event to engage with you on how we can improve collaboration and further strengthen our relationship as partners in delivering good health care for our people of Sierra Leone. We already know that the President is very deliberate about healthcare to our nation. In fact, healthcare is one of the strongest pillars in delivering the Big Five agenda. Under the leadership of Dr. Demby, as Minister of Health, we are very deliberate about this. We are determined and we are ready to make sure that every Sierra Leonean gets the health care that they deserve. To do this, the Honourable Minister has very innovatively and creatively introduced what he calls the life savings approach, which is a very technical way of saying that from the pregnancy up to the point when the child becomes an adult and senior citizen of this republic, he should have quality access to health care. And that health care has to be delivered with delicacy. This is why we are determined to make sure that the media accompanies us in this journey. It is critical because your role and ours interconnect at some point. Without us, it's difficult for you to have accurate and sometimes even life-saving information that can go out to the public. We saw this during the Ebola outbreak. It was also seen during the COVID-19 pandemic. So we value the partnership and we want to strengthen this. This is the reason why we're gathered here today, and we know that we'll have very fruitful deliberations at the end of the day. So ladies and gentlemen, I can see already a lot of representations here. I'm excited about this possibility, and we cannot wait to continue this event after today. So I wish all of us very fruitful deliberations, and I thank you very much. But just before I take my seat, I would now like to call on Mr. Khalil Kalon, who is the Executive Independent Media Commission, IMC, to introduce to us the chairperson of today's event. Please welcome him.
Honorable Minister of Information and Civic Education, Honorable Minister of Health, Chairman, Independent Media Commission, Dr. Isaac Masakoi, and our able President of the Women in the Media. Good morning, and distinguished participants and guests. Good morning. It is my honor to introduce the distinguished chairman of this town hall meeting. The chairman brings a wealth of experience and expertise to our gathering. He previously served as the head of department for mass communication from the college, director of the Institute of Library, Information and Communication Studies at the same Provincial College, University of Leone. Currently, he is a senior lecturer continuing his commitment to media development and education, and as well as community development. The chairman's extensive background in academia and his dedication to media development and advancement of knowledge make him an invaluable leader for our meeting today. Please join me in welcoming Dr. Isaac Masakoi, who is the chair for this conference.
Thank you very much, Khalil. I'm just saying to the minister that it's a bit called me the Mendy way. Masakoi. Yeah, thank you very much, ministers, colleagues, senior officials from the Ministry of Health. I'm very happy to be here this morning among friends. I've seen a lot of guys from across the country, and I hope we'll have a very good meeting today. And it's not just about ticking boxes, because a lot of people like to tick boxes. We've done this. I don't think that's what we're here for today. So when we get into the work proper, it will be like a classroom. So yesterday, I'll just make a few comments before pushing into the program, because I'm told that we really want to do business very quickly. Yesterday, a plane landed at the airport at Leone, a US Air Force plane. And we went into overdrive on social media, talking about the sinister motives of that plane. And somebody even called me to say that the plane is here to evacuate Americans because things were really so bad now, so they have to evacuate. I said, okay, because I wanted to make a few points, and the person was fighting me on the phone. I said, okay, that's fine. Just leave it. A few days before that, I saw, again, somebody sent me a picture of half a dozen or 3 dozen or so children marching far away, far back. And the commentary that came with that was, yeah, these people didn't go to school. They're all not going to school. And the person straight went on to talk to me about quality education and all of that. I said, okay, we'll find out. You know, 25 years ago when I was at SLBS at the time, I think we were the only station in this country at that time. So everything we said was heard by everybody in those places where we touched with our frequency. Because even today, the SLBC now is struggling with principle of universality, can't touch everywhere. But now it's getting to between 70 and 80%, which is really good. The point all of these things I'm saying is to make just one small point, that the landscape has changed. It's so changed in terms of the number of radio stations, TV, newspapers, and all these new technological applications that people are using that made the landscape so unrecognizable anymore. And these two senior politicians here can attest to the fact that they spend, maybe I'm wrong, a disproportionate amount of time trying to respond to things that people throw at them every day. So it's very, very tough terrain to operate these days, what we call the media. It's unrecognizable, absolutely. And the other thing I'd like to note is that there is this urge among practitioners these days to do extra things. Again, we'll push into this a bit more into when the town hall gets underway, where adversarial way of approaching this work appears to be a badge of honor kind of thing. We have to be, attacking every day. So it's a very serious situation in which we find ourselves, and that makes it very important for us to have a town hall like this, with a ministry as important as the Ministry of Health. You see, the other day we had that hospital at Lumley, fantastic place when you see it. I went there, opening ceremony done, everybody's gone. We will return in flocks again and media when there is no electricity there. We will not be going there to check the way the good things that are happening there. This is the way the media operates. So we have a lot of challenges to deal with, and we'll have a keynote address from the minister, which I think will be part of our discussion. The elements in that keynote will be there. Of course, we have our minister here who will say a few things to us as a guest of honor. I'm trying to be technological to get the program that was sent to me yesterday. So we have a very packed day today, and I urge everybody to stay in the room, because there's this tendency media would like to pop out of the room. We'll lock the door when the work starts. So nobody pops out for any, and we'll take your phones from you. So we actually concentrate and produce something corporate that will direct our future relationship with the Ministry of Health that has brought us here today. It is very important. Abdul Samba Brema described the thing as historic. I think it is. We have witnessed other functions, but this is the first one where one ministry has called media people together to talk about the way we engage with them. And I think it's a good start. So now, let's get into the program. I'd like to invite the president of the Guild of Editors, the president or chairman of the Guild of Editors, the chairman of the Guild of Editors, Mr. Theohadin, to make a brief statement. And I really mean brief. I'm the chairman here. Okay. Mr. Theohadin.
Thank you very much, Mr. Chair. Isaac Masakoi. I won't call it the Mendy way, I'm a Cree boy. It's Isaac Masakoi. Mrs. Ministers, I don't even know you, I call you Caps all the time. IMC Chair. My body / president, and my twin partner, the president of WIMSA. Ladies and gentlemen, good morning. Good morning. Good morning. I bring you greetings from the entire membership of the Guild of Newspaper Editors, Sierra Leone. And we're happy to be here, especially when we talk about health issues and journalism. Because health journalism basically plays a crucial role in shaping public awareness and understanding health issues. In countries such as ours, developing countries such as ours, the importance of accurate, reliable, and accessible health information is paramount due to the prevalence of communicable diseases, lack of health infrastructure, limited public health literacy. However, we face so many challenges, and these include, but are not limited to, resource constraints. We all know how limited finance constraints the media. We talk about media poverty all the time, and this is one of our constraints in passing on information. The chairman, Dr. Masakoi, just spoke about misinformation and sensationalism. These are other things we are faced with, especially with the social media being put upon us, like, to quote Chenor, like a bad disease. And we also look at, we also have the challenge of lack of expertise, where many journalists lack the necessary background in health and science to accurately interpret and report on complex medical issues. Then we also have the political and commercial pressures. Government policies, commercial interests can influence the content and tone of health journalism, leading to bias reporting. Mrs. Ministers, ladies and gentlemen, Mr. Chairman, just allow me quickly to highlight the role of the media in health journalism. The first and foremost is public awareness. We are made to educate the public about prevalent health issues, prevention measures, available healthcare, and the like. We also advocate by highlighting deficiency in healthcare systems and advocating for policy changes and resource allocation. We have the big task of debunking myths and also empowering communities. My constituency, which is the newspaper editors, holds significant influence over the content and quality of health journalism. And we can employ certain strategies to mitigate this, which include but not limited to prioritizing health journalism. That is editors prioritizing by allocating more space and resources to health stories, assigning specific reporters to cover health beats, ensuring accuracy and credibility, encouraging journalists to consult with media experts and public health officials to ensure the accuracy of their reporting, providing training for journalists, supporting journalists in pursuing further education in health and science communication, and promoting ethical journalism as well. We can also collaborate with health organizations by building partnerships with NGOs, government agencies to access reliable information and resource, and collaborate with health campaigns to raise awareness and promote health initiatives. In countries like in Kenya, the Media Council of Kenya has developed health journalism training programs in collaboration with international organizations, resulting in improved quality and accurate health reporting. While in Bangladesh, partnership between media outlets and health agencies have led to effective public health campaigns, such as those promoting maternal and child health. Let me just conclude by saying that the culture of health journalism in countries such as ours can be significantly challenged through the strategic involvement of the media, particularly newspaper editors, by prioritizing health journalism, ensuring accuracy, investing in journalist training, promoting ethical practices, engaging with communities, etc. This transformation for fostering a well-informed, improving public health outcomes, and ultimately contributing to the overall development of the country. Ladies and gentlemen, the media, under the stewardship of proactive and dedicated editors, can play a transformative role in changing the culture of health journalism in our country. This change is not just about better reporting, but about empowering populations with knowledge they need to lead healthier lives. I thank you.
Thank you, Mr. Chairman. Not very brief, but he has laid out a framework that we will try and work with in terms of specifics and strategies, that the Ministry of Health will take away from this meeting. At this time next year, it's large. All of us will have voted peacefully and replaced our president because it will be finished by June. But for now, he's still in the chair, and I have the honor to invite my president / to make a brief statement.
Good morning, everyone. The Minister of Health and Sanitation and the Minister of Information and Civic Education. And Civic Education, Dr. Masakori, and the IMC Chair, Mr. Pibinda Kapua. I see my colleagues from the provinces, Madam Bernard, Slat Chair, Eastern Province, Sam Lahai, and the former chairman for the Southern Province, also here. Good morning to you all. And let me first of all thank the Ministry for this initiative of a town hall meeting to build a relationship with the media, to be based on trust, on the transparency, and truth. So what I will do, I will just give a situational report on the relationship between the media and the Ministry of Health. I'll start with Sludge, and then I will go to the one with the journalists themselves, how they relate with the ministry, which are better from them, those who interact with the ministry. And then we'll give one or two strategies that we can use to foster and strengthen this relationship, so that we get to see more health stories, focusing on the success stories and the positives. So for Sludge, we have interfaced with the ministry. We have a very good relationship with the ministry. If you go back to Ebola, we supported the ministry to ensure that we're able to overcome that dreadful disease, pandemic, epidemic. And then with the COVID-19 as well, we've engaged. And we've also formed, our journalists have come together to form a network reporting on health. And I'm sure they have been interfacing with the ministry as well in terms of reporting on the health sector. So, but the health sector is unlike most government departments, ministries, or agencies, because of the significance of the impact of the services they provide on lives of the masses on a daily basis. So a lot more attention needs to be given to focus on this ministry. This means that journalists are likely to report more on the health ministry's activities than those of many other ministries. Admittedly, this means that the ministry will be inundated with responses or requests from journalists and media houses for responses. But sadly, according to the journalists, this has sadly matched the demand for these responses. And to make matters worse, there's a deliberate attempt to make reporting on the sector difficult for journalists. It almost feels like an unspoken policy which enables health workers and officials at the Ministry of Health to refuse to talk to journalists when they want information. One common way to do this is by asking reporters to get permission for them to talk, instead of the officials themselves seeking permission from their superiors or their bosses. This has made reporting on the sector one of the most difficult in the country. It has also led to bad press for the ministry, partly due to deliberate acts of unprofessionalism through disinformation by journalists, angered by officials refusing to speak to them. Many other journalists have also reported on the basis of information at their disposal, which turned out to be mostly sometimes untrue. So there is no clear pathway to seek approval for interview at the lower level of the health ministry. Yet, if for instance a journalist wants to report on the local health situation, maybe they just need response for a claim by some community people against the local health facility. The chief health officer or nurse in charge will ask you to seek permission from the permanent secretary at the Ministry of Health in Freetown. Forget about what it will require for an ordinary reporter to get to Freetown, just to get answers to a simple question from the top government official who will definitely have no answer to that. Imagine also a reporter trying to get audience with the permanent secretary of the Ministry of Health or any other ministry or extension, by phone or in person. This may not be the same for a few privileged journalists, especially those who are politically connected, but it is true for the majority of journalists who are covering the health sector. We have also observed another worrying trend wherein bloggers, or so-called bloggers, are given more access than mainstream journalists. Bloggers with political affiliations to the government of the day can have access to top officials, whereas it is near impossible to get seen by regular or trained journalists. The reason for this is that officials are more concerned about the large following of these bloggers, but they fail to realize that these audiences are built through unethical practices most times. This and misinformation, which the regulated media cannot engage in. A blogger who is today engaged in propaganda by reporting mis and disinformation will tomorrow be at the forefront of efforts to disseminate important health and socio-economic issues to the public alongside government officials. How can the public tell between carriers of trusted information and those openly engaged in disseminating fake news and sensational news? So that is basically the report, the institutional report from the reporters on site. I'm sure the minister is here and the Minister of Information will respond to that in terms of what their own side of the story is. That this is the side of the story of the reporters covering or the journalists covering the health sector. So enhancing this relationship between the Ministry of Health and the media industry for responsible reporting and efficient health service delivery involves the multifaceted approach. We're talking about community engagement. This is one approach, town hall meeting, where you invite the journalists to meet with them and you discuss health issues together that concerns the community. Regular press briefings from the ministry and also health, but at the heart of that is transparency. Ensure that the information shared with the media is accurate, timely, and transparent. This builds trust and credibility. Transparency is also key in the fight against corruption. By making health information accessible, it reduces opportunities for corrupt practices in the sector. This can lead to better service delivery and resource allocation. Transparency can also lead to more efficient and effective public services. Citizens can monitor the implementation of health projects at the local level, at the community level, policies, ensuring that they are executed properly. For example, the SDG 3, good health and well-being for all citizens, requires access to health-related information which can improve public health outcomes. We can also engage in capacity building. The ministry can also organize training programs for journalists to improve their capacity in reporting on the health sector, on the activities. We already talked about access to information. It's very key. The ministry can also do some recognition or awards for journalists who are doing excellent work in reporting on the health sector to motivate others to continue to do the same. My colleague talked about building relationships. This is also key to informal meetings, doing media tours. And also establish a platform for feedback so that we have two-way communication with the ministry and the journalists, so that they know exactly how the journalists are doing the work and what the challenges they are going through and how we can improve on the relationship to get access to the information. And also the ethical guidelines on reporting on the health sector, which I'm sure some of these are covered in our own ethical code of journalists. So basically, I hope that the deliberation today will bring out more sincere and discussions about how we build this relationship based on mutual respect and trust, and so that we can be telling positive stories about the health sector. Regarding so much happening in the sector, it's one of the biggest ministries we have. The nation depends on the health of its population for it to develop. So Once more, I want to thank the Minister of Health for this initiative and hope that this will not be the last. This will be a continuation of what we do in this trust in this relationship going forward. Thank you very much.
Thank you, Mr. President, for that presentation. It falls again in line with what our friend has done, and I ask the organizers to make those two presentations available as we go into the full session. You know, when journalists cross the line, I will believe that they've crossed the line sometimes against the ministry official or the ministry itself. The next step to turn, the next place to turn to is the IMC. So I spent some time on that IMC board, and we had to deal with a lot of these kinds of matters. So it's no mistake that we have them in the room today to share some perspectives with us, how the role they can play in fostering relationships and going forward with whatever document will come out of there. They are represented at the highest level today, two guys here, the executive secretary here, and the chair of the commission. So I now invite the chair of the IMC, Joseph Ebeda Kapua Esquire, for his statement.
Thank you, Mr. Chairman. This large president made a very important comment that appears to take center stage in the country, the issue about bloggers and reporters. Perhaps the IMC also needs a town hall to actually define who a media practitioner is. But that should not detain us. Mr. Chairman, Honorable Minister of Information and Civic Education, a friend, a brother, and a comrade, Honorable Minister of Health and Sanitation, President of SLAJ, President of Women in the Media, and all distinguished stakeholders in the media industry say good morning. It is an honor to stand before you today as Chairman of the Independent Media Commission, the IMC, at this important town hall meeting organized by the Ministry of Health and Sanitation. This gathering is a testament of the Ministry's commitment to fostering a robust partnership with the media, recognizing the vital role that the media plays in Sierra Leone in shaping public opinion and disseminating accurate information. In recent times, the Ministry of Health has faced numerous challenges, particularly in combating misinformation and addressing negative press. As we are all aware, misinformation can have detrimental effects on public health initiatives, eroding trust and hindering our collective efforts to improve health outcomes in Sierra Leone. At this meeting today, we have an opportunity to bridge any gaps, to enhance our collaboration and find common ground to support the ministry in its mission. By working together, we can ensure that accurate, reliable, and timely information reaches the public, thereby promoting better health practices and policies. As media professionals, we have a responsibility to uphold the highest standards of journalism, especially in matters of public health. Our role is not just to report, but to educate, to inform, and also to empower our communities with the knowledge that they need to make informed decisions about our health. I therefore encourage all of us to engage in open and constructive dialogue in this session this morning. Let's explore innovative ways to strengthen our partnership, combat misinformation, and contribute to a healthier Sierra Leone. I am sure together we can make a significant difference. Thank you.
Thank you very much. This is my idea of a brief statement. Not yours. So let's hear from our women folk now. Women in the media, Sierra Leone, Windsor. The president is here. She's a lady I like listening to. She has fire in her belly. It's Tina Taylor.
Good morning. I hope I'm tall enough for you to see me, because most times the people making these things, they discriminate against short people. And we are like, please, when you make these kinds of things, please can you do it shorter a bit so that I'll look tall. Please, I'm not all right. I'm glad that Dr. say this troublesome here. Okay. You miss me again. I don't know if I'm because I'm the only woman sitting on the table or because I'm short. But anyways, thank you for calling me. I appreciate the fact that you miss me because you gave me the time to listen to the senior colleagues and to be able to respond. I had written down I think it's 3-minute statements, but I would like to talk. And yesterday, somebody just called me that you go in at the panel and you're not the only woman. This is not fair. If I had the power, I'd bring one more chair and put another lady here. But unfortunately, I don't have the power. We need more ladies. When it comes to health reporting or health journalism, we need more women. You know why? Because we come with empathy. We come with a different perspective because we're not only journalists, we're caregivers. We have children. We bring them to the hospital. We know how reflective, or we know how difficult the health system can be. As a journalist, if I had my child, if I'm taking that child to the hospital, it would be a whole day journey. And meaning, I would not go to the office. My boss or the colleagues, the male colleagues in the office will say, that lady, you're not serious, at least we talk about journalism. Forgetting that I am a mother, but I'm also a journalist. And sometimes when these two roles, when they conflict, I'll have to look after my children, because I'm going to a generation of men and women who are going to take over. So we come with a very unique perspective in health journalism. So when we are thinking about bringing more into the health sector, bringing more journalists, making them present, making them become, making them care about it. We must not leave female journalists behind. I want to say good morning to Honorable Minister. The Minister of Health and the Minister of Information and Civic Education, and my senior colleagues sitting on the table, and all of the wonderful journalists here. You guys inspire me a lot. So, I think I look at the me being here and I say, okay, well, it's because I have reported on health for a very long time. So, apart from my mainstream time in reporting on health when I was with AYVNO, I joined with Media Action, and a few years down the line, I was the presenter of a health program called Powerful. And I taught the subject, I trained young other journalists, and also I transitioned from Tower Body working for BBC to On Our Radar, where we put people at the forefront of health, reporting on what's affecting them, looking at living experiences. So I know what it takes, and I know how it is important for journalists to use empathy, to also be able to bring out the stories when it comes to health journalism. In today's rapid changing world, the media role of health journalism is really, really key. Don't worry, I will not take so much time because there's so much time to talk. But it's so key to the point that when we look at journalism, most times we forget that when it comes to reporting on health, it's very fragile, and it's something that we don't only report on the surface, but already what is known, but we delve deep into the issues, going beyond what is already known. And in today's world, where the media role in health journalism is more crucial than ever, As we navigate the complexities of health challenges from pandemic to mental health crisis, the media stand at the forefront of guiding public understanding and shaping health behavior. Our role is not just the surface, as I said earlier. The media has a powerful way to inform and educate, and even in health journalism, and by providing accurate, evidence-based information, journalists plays a pivotal role in bridging between the complexities of medical research and everyday lives. Our role is to make things that are too hard to understand easily understandable to the public. Our role, when we see giants, when we see things, our role as journalists is to break these things. But most of the time, what happens is when we try to do that, there are roadblocks, there are barriers. And you will see these when you call a government official working for the ministry, that I want this information. I need this information. I need you to come to the studio. They will say, well, I'm busy. But I know you're busy. But I know the work that you're doing is important. But if you don't talk about it, people would not trust you. And we all know what happened during COVID and Ebola. The trust, the gap, the space that opened up. People say, well, I would not go to the hospital. I remember working during COVID-19 for BBC and doing training and going to communities, and people would say, I would not set my foot into that hospital. Why? Because they're scared. They don't understand. There are lots, any area where misinformation, disinformation, and malinformation, where they spread like wildfire. It is our job to work together with journalists, because when Ebola came, when COVID-19 came, journalists were confused, just as the people that they sound, because we don't know what to say. We are not experts. We, in health reporting, we are mere facilitators, because you don't want to say one thing that will just disrupt every other thing. So as we sit here today to talk, I hope that we will all feel open, we will be able to talk, we'll be able to look at each other and say, well, this is where you get it wrong. And say, this is where we need to strengthen. And these are the roots that we need to look into and solve. I'll stop here and say thank you.
I told you that she's a lady I like listening to. Thank you very much, Madam President of the Women in Media, Sierra Leone. Now, when I started in my opening statement, I mentioned some incidents, recent ones, from US Air Force plane, Falaba Chin, and all of these things. And I was aiming at the Minister of Information and Civic Education, because it is his responsibility to always come and put the other side, to say, oh, actually, this is what's about. And even to some extent, they've had to put government papers that are normally left in the files to the public, because of the way things are today. So he has an enormous responsibility. I suspect that has reflected in his budget, ministry's budget, communication budget. Ladies and gentlemen, I have the singular honor. It's not every day we get an honor like this to introduce Minister of Information and Civic Education, the Honorable Chenor, for
Thank you. The Honorable Minister for Health. By the way, one public information is that the ministry is no longer Health and Sanitation. It is just Ministry of Health. You will get into trouble with my colleague who is now the Minister for Water and Sanitation if you keep referring to this ministry as Health and Sanitation. Honorable Minister of Health, thank you very much. Mr. Chair of IMC, President of Women in Media, friends of the 4th Estates, members of the Ministry of Health, fraternity. Assalamu alaikum, I greet you all well. It's great to be here. I think big things are happening in this country. The health sector is witnessing a seismic transformation. Not also in data for forget the Ministry of Health. And I don't say I get to talk to you. I think everybody knew that I was going to speak to you at some point. You have the Ministry of Health. You have a minister that understands that for let me change here, there's one about the work that's been done, but there's also the need to bridge the gap between the quality of work that's been done and the people getting that information. This is a minister and a ministry, by the way, that have demonstrated that they understand the instinct of public information. We cannot win, you cannot win this life stages approach that I'm sure is going to talk about. We cannot win the health challenge battle in this country if we are not communicating with the public. Health is the public. Before we came in here, we were discussing and we both said that the only sector you cannot truly say, I'm not going to forget nothing for do it, now health. At some point in our lives, we are all implicated in the health system. And when we had the minister at the press conference I think a couple of weeks ago, I said something that when we've been deciding for Move Come Back Salon, I did a long video with my family. You know, my kids, we moved back to this country. The one risk we take to move to Salon, it's not quality of life. The quality of my life is better here than it was in the US, I can tell you that. I lived well, but I can live a bigger life here. You can take care of all your amenities. Everything else is guaranteed here. The one big challenge typically is health. If something happens to you, immediately the first instinct is, if you get small money, bam, for common here. Because we, for a long time, we get belief in the health sector. That's what this minister, that's what this ministry is changing. We see the ultra modern Peking Hospital with Demby. We see the plans that they have across the country. We see all of this transformation that's happening. But I'm here to say and to reiterate what I know the minister believes, that even if they change all of that, remember, it's both belief, it's perception, it's also reality. If they change the substance of the health sector and all the transformation that's happening, it will not change the perception, it will not change the public information on the health sector. We still have not done the full job. That's where you come in, my brothers and sisters, the friends in the fourth estate. And I know there's a big discussion now about the difference between all the bloggers versus the non-bloggers. I know there's this tension where if the traditional media they look down on the bloggers. The fact of the matter is that this is not going to change. Your sector has changed. Our sector don't change. All man now are journalists. Everybody now can report. Yesterday they sent us, as Doc was saying, into a tailspin, literally. Maybe in the Pambe in Abu, my colleague starts calling me. They say Air Force plane don't land in Alungi. They say don't lead to fake news all over social media. I started looking into different groups. Wildfire. And then they force us to go out of the way to say because there's a lack of public trust to provide the real information. Even after that, some people still they continue with fake news. Yeah. But the public trust deficits, not just because of people not believe in we government, but also in una, when are the intermediary between we and the people. Because if one good journalist pick up the phone when you see that news and reach out to the ministry or to civil aviation and get the information and release it on the public, that one good journalist in peace supposed to be so powerful that it will bring down the fake news. This is the challenge that we have. Somebody has mentioned the challenge of gotcha journalism. Yeah, I'm so used to it now. You see all the basic things Ministry of Health is doing. Sometimes we see so much bad fake news online about the ministry. and people are focused on the small negative. I had a big argument a couple of weeks ago with your fact checking. Good. I went on air. I said, last time we was a new kind of power, energy access was about 13%. I used the English word about 13%. The fact checker, the official fact checker, they say they don't go check. The real number are 15, and then slam seriously the minister said was fake. They did it. It's that bad. I used the English word about 13. They don't even say potentially misleading. They don't even say the minister can be more specific. They say the minister don't say fake news. False. Because there's this desire for over sensationalize and false like bigger, it will run faster than if you say, oh, well, the minister can be more exact. No. You need to say more because you're thinking like you compete with the blogger. Because the blogger you need to go faster, so you say you have to go faster. We for resist that urge. And I think what today is about is to say, let's bridge the gap. We all have a similar interest here. We wanted this country to go before. The minister, day and night, in colleagues in the ministry, we wanted this country to go before. We want to change the narrative of the country. We want to change the reality of this country. That change then requires a strong, dedicated partnership between we and UNA, as governments, as the fourth estate. And I think what we don't try to do so far, now for sure, I say we are available. Like me, I'm available. Anytime you pick up the phone and call me, I'll answer. If you know you will get me, there are other colleagues in the office where you get them, they reach out to me, we provide the information. So before you hit send, before you go and put bad news, before you go and put something you call stare, just ask. We want to ask for let be biased. We ask for let be fair. We also ask for let you self-hold, just like I hold me to a high standard. You self, before you check, you put false or fake or lie news for we or any of we always self-check and hold yourself to a high standard. So I want to take this opportunity again for telling you thank you as the fourth estate. Because in the midst of all these other complaints that we have and the challenges that we face, a lot of things are going well. We don't change or work with him. You also have changed a lot of things, and things are getting better. We have an excellent relationship with Sludge, the Guild of Editors. We're building on that. And in this partnership with the Ministry of Health, which, as I said, is probably the most important ministry for we all with survival as a state, as individuals, as people in this country. We begin a life, from normal life, new life, adolescence, at every single stage. So this is a call for say, let's build on that partnership. Let we focus on how we tell the positive stories and the challenging stories. Let we go deep down and let we be focused on the facts. I look forward to this partnership. I look forward to the Minister of Health in statements. But more than that, I look forward to the interaction where I hope it will be the highlight of today's engagement. Assalamu alaikum.
Thank you for your goodwill message. Well taken. Ladies and gentlemen, I'm not going to attempt to introduce the Minister of Health. I want to come out quick to go and do something else. But every time I think about the Minister of Health, I think about Ebola. But that's the first time I heard his name, CDC and all of that. I said, there's a Leone there. Okay. So we're going to listen to the Minister of Health. Let's do that carefully. And again, I want to ask that the presentation be made available for the substantive, or not substantive, for the town hall itself. Mr. Demby, please. Thank you.
Thank you very much. Thank you to Dr. Mascoy. The anglicized version of that. Yeah. But Honorable Minister Chenor, one Sabi talk minister. So we tell the story. I just want to stand on existing protocols. I want to acknowledge the high table and acknowledge everybody with them. I think the preferred language are cool. We talk and make sure say I know they only talk to we all there, but also they talk to the nation. And we all understand. So we'll get a form of Quenglish inside it. But just a few things. We are for reintroduce myself to small bits. And why are they also today? To be try to accomplish. And I want for share with una waiting now the ministry in vision and why make this vision really important. I want for also talk to the role of the media for let we realize this dream. And just a few things I want for acknowledge at the outset. Number one, the fact that we know say we not to mirror to ourselves. We know they see ourselves. Yeah. Now una they see we. Now una they see we directly and now una they see we on behalf of the people of Sierra Leone, all 8 million of them. So we respect that. We respect the partnership where they come with that, the constructive relationship where they come with that. And the notion say, if we succeed, now we not succeed. If we succeed and we not succeed, the salon succeed. So we did in this collectively, we did in this together. One of the first important things a person for the way you get this kind of job. Now for check your pride na Lungi Airport. You get to be modest. You get to get a listening ear. And you know they only listen, but you also they yay waiting and they say. And we want to tell them, I say, the ministry, if you're not obvious to us, a very listening ministry, and if you not gets to so on go, we'll try to do a better job for not only listen but understand. Me, I'm in the America. I mean, they also, I've been director of facilities in Ashebema in the 80s. I worked on hemorrhagic fevers for 18 years. I worked on HIV, I worked on TB, I worked on plenty sickness. Well, in America, I mean, get a budget of $2 billion where they manage for 88 countries there. So the president in all the countries, all the go Tanzania, Zambia, they help them for building a health system. So the president said, boy, you did go help other people there. Why you not come home and come for can help your people there? So we dropped all team. I left my wife and we picking them home. I said I come home for can make a difference. So what I can not to Kalu business, that commitment, I really believe in this country. I believe that we can change this country, we can able to make this country not to be defined by the circumstances we find ourselves. Not so for do something where you're able to succeed today, or you succeed tomorrow, or you win the next election. The president envisioned that for build this nation, we could make sure we all be proud of her, not only today, not only with Pekin and Pekin and will say, this now is salon. Now that salon they want to build. And it means say the health sector now a very important platform for that transformation and that development. And we approach not a small catcher. You can do that very easily. You can look for the next shining object. You want ambulance and a 2 ambulance and one hospital and something and away, all man the fella. Yeah. But what you want to do now, fundamental shift in the healthcare delivery in this country. You know they do that overnight, not a light switch where you turn on and off. So for the past 3.5 years, now major transformation on this thing, now this country. Perhaps I not feel like it. When I begin to feel like this. First thing, healthcare delivery in this country, now disease, now sickness defend. You get malaria program and you get TB program and you get nutrition program and you get immunization. All manner of different programs in the work on a specific program. Well, all them programs don't mean nothing if you're not relevant to the one person. Because now the one person I need the vaccine, now the one person I need the malaria treatment, now the one person I need the nutrition support, and the one person I need oil stunting. All of them they around the person. Because you can get the best malaria program in this country. The best program. Then somebody die of typhoid. Somebody die of upper respiratory disease. Somebody die of heart attack. If that didn't happen, then you find malaria program, it don't mean nothing to the person. So what we don't do now? We don't change the complete outlook of healthcare for say, for let me able to do healthcare in this country, we get for embrace what they call universal health coverage. We mean say everybody, all 8 million of we matter. And the healthcare system for able to see everybody. The healthcare system needs to recognize everybody and provide services for everybody at the individual level. And every one of we for able to see themselves in the healthcare system. Now that transformation they will do. We call them life stages. For they able to see everybody, we don't say everybody they go through life change stages. Start from the Leone. The Leone need to be healthy and strong for your own health and for the health of the baby we get. So what we commit say we now yeah every Leone we did now we Leone na the health sector. Now we get that belly. We get to do everything we can for all 300,000 of them Leone every year for make sure they remain healthy and then deliver safely. When the baby born, we get responsibility to say that baby they first we don't fight for in life till we it in my mind womb till it don't come, it don't arrive. We make sure say it arrives safely. Now we get a responsibility for do all we can in the health sector for make sure say this baby it not only survive, but the baby thrive. Till this baby go kindergarten, where it is ready for go school. We want to make sure say this baby are in health. It is in good place so this baby are ready for go kindergarten. When it come up kindergarten now, it goes school. We get what we call school health. We get for make sure say the healthcare system, it recognizes the school picking, it do everything for this picking health. For ensure say it healthy, so it will focus for in learning. Till it become adolescent, till it become an adult, till it become a senior citizen, from pregnancy all the way to senior citizen. The healthcare system need for see everyone and for provide services for them. So now we say Leone, what's in our name? It means that Leone we get for make sure so you get the best malaria program, you get the best TB program, you get the best nutrition program, you get the best vaccination program all around. We call them patient or client-centered care. We make sure so the baby where you don't born now, you get all in vaccine, so you get, they die of any vaccine preventable illness. We make sure say all that they are available to. Where in the school, if the beginner they see fine in a class, you remember say go learn. If you get malaria, if you say go learn. If you get diarrheal disease, go learn. So they make sure say the healthcare system, they focus on school age kids for make sure say then sleep on a bed nets. They even get all the vaccination, they not get measles or other disease them. They make sure say the nutritional state right. Say for let they able for focus on their learning. So now you can see say we don't change the whole of the healthcare system now across the board. And then changing it not easy. You know, easy way all man used to say, na me malaria program no more they work on, or na me TB program no more they work on. So now we see the whole care system, everybody, you get forget patient-centered care, client-centered care. At the same time as how they do this now, we need to do at random. We just set targets. You see, for example, Leone in the first and Salon being the set record in the world for the highest number of maternal deaths in the whole world. That's in the world they score like 1,300, 1,100 per 100,000. The second place they're like 900. We did so far out. But all begin set targets there now. We should don't begin with this from 1,300 to 717. What can have been 717? Now don't go for 443. And the last time we'll check, well, they can't announce the number, but you don't go down even further. We do the exact same thing for the beginning. Now we don't declare an emergency for the beginning with a set up system for make sure say all the beginning, we monitor them from when they're born till they're 6 years old. So I just want to know all the changes that already happen. Yeah? It only go succeed if we, the healthcare worker that we understand, we're able for manage the program them. At the same time, I think the one we speaker they mentioned that, you know they ever do healthcare if the public no mix. The public need for know. They need for understanding. Therefore, be co-creators and partners with we as you to transform this healthcare system. You see that Nepal Ebola? Yeah? If you get the best vaccine, the best doctor, the best scientist, and this person sit down and will say, me, I'm not going to hospital. No way she tell. You know what happened? Yeah? We get a situation, we get a mobile bus and now where they go. We go to the mobile bus, the bus they go park. And they say, manual, as well as we colleague from the women's journalist and talk. 60% of the healthcare use now woman and the utilizer for themselves and for them picking them. Yeah. So first we get for give woman respect and authority and leadership role for able to run the healthcare system also. But besides that, them bus thing they go, with them parks on side, them man in the rush day, you know, see man in the only go hospital when they get injury, when they get trauma, when they fall on a bike or something. But then they go there with the see say the number of high blood pressure that all they see is unbelievable. The number of diabetes they all they see is unbelievable. The number of chronic illness they all they see inside the community is unbelievable. Until we change the healthcare system, because we get high blood pressure, you don't manage them. By the time you come to hospital, not stroke, you don't get, or you don't get heart attack, or you don't get kidney failure. Whereas if we go inside the community, we'll meet you there with your high blood pressure. We can manage the high blood pressure. We can do it with lifestyle changes, with what you eat. If you reduce the Maggi, small bits, you reduce the salt intake, you exercise small bit, you can change that. But if the public don't know, the public don't understand, we just sit on a we wait for Leone hospital. Leone hospital, like catastrophic incident now we get for deal with. And I say all of this for Leone understand. Say this now new changes where the minister say tectonic shifts now in the occur in the healthcare system. When we don't do this life stages business, WHO don't adopt and now all the countries in Africa and they send representatives for let them go begin adopt the system and see how they will change their approach to healthcare delivery. That's how now they lead that process. So again, we do some really, really great things now, so but we will only succeed if the people then come along and Una as interlocutor in the media, no get to make this possible. The other thing, if you want to really understand healthcare delivery at this country, now 4 major pillars that we deal with. 4. Number 1, we get commitment for primary healthcare. Primary healthcare means that you take healthcare to as close to the people as possible. Yeah. So in this country now, we give people an access. If you look the map, the scattergram of Sierra Leone map and the availability of primary healthcare system, Sierra Leone gets a health facility where they accommodate for over 85% of the population. They get health facility where they're within a 5-kilometer radius. So you don't create access. The challenge we'll get now for bring quality to that access, and down there will work on. So if you take healthcare as close to the people, and you want to bring quality to I'll talk about the quality issues later on. The other major component of this now, for make sure say, if you get breakthrough, if you get much more complicated cases, now the primary healthcare unit, you need to get secondary and tertiary facility that we're ready for take them complex cases. We'll be able to manage them. The third, not forget referral systems around it. One important, not just take one example, the Leone. Not the way the person they deliver, not the most important critical step. From the time when you recognize say the person don't get belly, you get for the work with them. You get for the work with them and you should say you get all of the vaccine them, you get all of the treatment. If you get underlying conditions like high blood pressure, we manage it. If you get underlying condition like diabetes, we manage it. If you get underlying whatever congenital illness, that we manage it. Because if we do all that, by the time you come, follow you can deliver. Now we know if it's not complex delivery or not simple delivery. If not complex delivery, we're going to make arrangements so that you get access to the secondary and tertiary facility. So 3 major things: primary health care, secondary and tertiary care, third, now referral networks. And that really work on. The fourth one, health security. Health security for ensure say we prepare for, we're ready for, and we're able to respond to outbreak then. Because if we're not ready, waiting Ebola teach me, if you're not ready, it will disrupt you one whole healthcare system. People have not been, the people who die of Ebola, there have been plenty. But people who die of everything else because we not pay attention, they're even higher. So, life stages, so primary, secondary, and tertiary care, referral system, and health security. All of this, we do with a per capita health expenditure of $46. Every one of we, now $46, right? Government will set aside for your health. If you want to put in perspective, UK, $5,500 per person. US, $12,000 per person. We get 46, but we better pass Guinea, we better pass Liberia, better pass, but put all that countries with $46. So responsibility now, how to use that $46 to the best of our abilities. Not only will they pay doctor them with, they pay nurse them with, they build hospital them with, they do all kinds of it. So I'll tell you something what they do that with $46. Number one, we not say the doctor, they're not plenty in this country. If you go America, you go England, you go Germany, sometimes one hospital, no more, they get 1,000 doctors. Sierra Leone, for the one country with 8 million people there, now only 500 practicing doctors that will get. Of the 500, about 300, about 150 administrators. So only about 350, but the number don't begin to go up small bit now. But one of the first challenges our challenge, Professor Wee, as Minister of Technical and Higher Education, I said, look, we cannot do this. We produce 50 doctors a year. If we produce 50 doctors a year, we need about 5,000 to 7,000 doctors for provide services for 8 million people. Well, 50 a year, forget 5,000. 100 years in hotels. So that's what Professor we and the team will arrange. 3 years ago, they increased the number from 50 to 200. Last year, they increased it up to 300. This year, 600 enrolled students for medical school. Not only that, we don't start other medical school in Nigeria. So as we train in medical school here, one of the stories that I need to understand that this primary healthcare will not work on, and if all the development partners put their money. It's a lot to take healthcare as close to the people as possible. One area will not invest seriously on secondary and tertiary care. So now you see the Connaughts for a long time will not get resources. All that during PCMH and then provincial hospital and in struggle. But what you don't decide for do now, forget the balance, right? Invest in primary health care. At the same time, invest in secondary and tertiary care. Now I make when see the new hospital along it. Now I make in the next couple of weeks, you see 3 new hospitals in the Kao. Then I make we get $50 million to build a brand new hospital in Terrytown. And I make we build a brand new pediatric maternal and child health center at Chenor. Then I make we go in South Korea. We talk to the South Korea and then follow build $150 million hospital at the center of the country. So as we train the doctor, as we train the nurse, as we train the technician, that's what the make sure we build the institutions as well. Again, now we get MRI in our church house, but we're not satisfied with that. Right now, we're in the process of procuring 2 CT scan machines. One for Connaught Public Hospital, one with the Cargo Kenema. As a starting point, let's see how they use that. They will begin including every regional hospital for getting kind of capabilities. Because their hospital had been built in the 60s and the 70s for a small population. The population don't grow, they explode around them. Technology don't move on. So what in this government will say now, we did deliberately invest in secondary and tertiary facilities, even as we improve primary health care in the country. The domains of quality will they work on are 4 major domains. One for quality now, infrastructure. Infrastructure, we don't determine, say, but who hospital them? The generator, what did they? They use nearly 20% of the hospital in revenue for get fuel no more. And in some cases, up to about 50% of the revenue. That is not sustainable. So what we don't see now, when we go COP Dubai the other day, we make a commitment, this year, and they go completely green. We they move from diesel power generator of the hospital there into sustainable energy. Right now, we get resources we don't nearly complete 11 of the hospital there, the major hospital there. We get resources for over 200 PHUs. We raise additional funds. By the next couple of years, next 2-3 years, when the major say no hospital no need diesel generator for run them. We run them purely by sustainable renewable energy. We change all of the light bulbs from all in tungsten heat generating light bulbs into LED bulbs. We plant green trees now, all over the hospital there. We completely transform the healthcare system in physical infrastructure. We make sure say we provide our solar energy not only for provide electricity, but make sure say all the equipment that we did they're compliant with renewable energy. We able to make borehole in our medical facilities so they're able to get good water supply as well. And we want to keep them places clean. We want to keep them tidy. We want to give them a lick of paint so that people don't know one for body. The number 2 quality issue is now staffing complement. We need to get the right complement of staff, nurses, doctors, midwives, the right combination, and the right attitude of patient-centered care. The third component is for make sure they get the right equipment and supplies in the timely manner needed for their job. The fourth are drugs. So if we get them forward in there all throughout the country, we will kind of see the kind of changes all they expect. So I say all of this for Leone know waiting the government try to do. And we did in some transition phase. Things they change under our nose. We want to help with for understanding the people that understand what they do for them. Let them be part of the solution. Let them be active to the solution. One misinformation, one false information, we did it. It will make me struggle so hard to turn things around. Right now, last week, UNICEF gave ministry award. In fact, not a ministry, they give Salon Award for being the country in West and Central Africa with the most excellent vaccination rates over the past 5 years, consistently. Whilst we're in the high 90s, the average now about 67%. We don't know how for over 5 years. Somebody go can say no more. That vaccine when they give people, and if you get that kind of wrong information, it go inside the community. We spend so much energy for turnaround. So it's really important that you get a media when a partner where you're able for criticize we, but at the same time stand up for wrong information. As we do all of this as well, if you see, say, people are not listening to you, I mean, like way President Nasrallah just say, if we not do something right before, we'll try for corrector. Yeah? Now we'll all be in this together. Yeah? The only thing I'm all man gave me phone number. All I gave me phone number. Something happened at Krubola, 2 o'clock morning, and call me and say, hey, something happened at Krubola. You get for Mr. You get for do that about something about I'll tell you something, honestly. I get 4 to 5 hours sleep every night. Saturday no mix, Sunday no mix. I work flat out. And so now the rest of the team. So not a perfect situation. We get people in there where they work extremely hard. We get people in there where they work as hard. On our role now for help with for celebrate the one where they work hard. Now, role now for help with identify the one, and we cannot run this business out of your building. Now, for help with for identify which side are the weakness and which side are the side that we need for put more effort back. We get plenty party there. Plenty party there we were happy. Last week, now one of the hottest weeks there for me. Global Fund come and give you $136 million. While we party, you give you some resources followed by 22 motor cars for we work mining. They give you $3 million for buying new drugs in the store. The places. Then we get this vaccine, what they call credit, where they give you. So we do extremely well. It will find for the way we will capture that and share with people, but at the same time, hold me accountable. Hold me personally accountable as we delegate responsibility to people that are in the field. As they work with the public. This is a partnership. Three parts to the ministry, the public, and the media. I think that together we will solve this problem in this country. Thank you very much.
Thank you very much, Mr. Minister.
There's a lot happening in the sector. So, Mr. Byman.
So at this point, we now call on Mr. Steve Gauja to lead us in a conversational session on partnership.
So, I don't record a lot of what the ministers in our phone. For just keep track of some of these things then, and then see how things to go. I want to invite Mr. Steve Gauja. Mr. Steve Gauja, I'm a man, very active man, good man. We work on the Ebola response to this country. And, he's very engaging speaker. So he can lead me into a conversation around partnerships and anything and let's see how we go. 2 minutes are still there for us.
Thank you very much, Mr. Chairman, and honorable ministers, the guests at the high table, ladies and gentlemen. I think still we all know here what the minister say. And clearly, the Ministry of Health, under the leadership of Dr. Austin Demby, is on a transformative journey. And we want each and every one of you to be part of this journey. When I listen to the approach, when you get the life stages approach to healthcare delivery, when he has articulated this everywhere he is gone, and now anybody will not be around the minister, don't get to the middle of understanding as to how we will adequately deliver health services in Asalo. And he's always done this. If you have listened to him recently speak, apart from the fact that he will always articulate the vision of His Excellency the President, but he always talk about 3 A's always. They talk about accompaniment, and they talk about alignment, and he also talk about acceleration. But I think when he talk here today, there's another A to this aspect. That A is accountability. Every one of us on this journey of transformation must be held accountable. The one who is held accountable, who all the other personnel and the ministry and the healthcare service centers accountable. But we also believe the media must be held accountable equally. So we want to create ownership of the process. And it's that ownership that we want to talk about today. How can you own, the media own, healthcare delivery in this country? So before I proceed and call on James, let's just present a short video as to how things have been happening, and then we'll take a discussion from there. Please. Yes.
Thank you very much. Honorable Minister of Health, Dr. Austin Demby, Minister of Information and Civic Education, Honorable Chenor, and esteemed members of the IT group. Ladies and gentlemen, the video you are about to watch is one of many bold and transformative strides of the Ministry of Health under the leadership of Dr. Austin Demby. As we all know, the relevance of sustainable energy to healthcare is vitally important and it cannot be overemphasized. As the Minister mentioned, at COP28 last year, he made a commitment to go green for health. And in that light, the Ministry of Health has succeeded in solarizing about 11 major government hospitals and even better plans to solarize all government hospitals in the shortest time. The impact of this, as we all know, especially for thousands of our women and children, is immeasurable. Without going any further, I'd like to introduce you to the Health Certification Project here.
His Excellency the President, retired Brigadier Dr. Leone, made a commitment to the people, a commitment that says every person's life matters. And so we're translating that literally into our actions on the ground. A prerequisite for that is to have a facility available and accessible to the general public. And one essential ingredient in that, as part of the infrastructure requirement, is energy.
Most of our healthcare facilities, particularly those in rural areas, have no access to electricity. Those in the urban areas mainly are those closer to the national grid. And even that, it's irregular. So this inconsistent supply of energy to our healthcare facilities is affecting healthcare delivery.
When the baby is ready to come, they really don't care at all. You have to be ready for that. I think right now what we have is a system where you rely on the power grid. At times it comes on, at times it doesn't. You rely on backup generators that are very expensive to run. In some cases, it costs nearly 20% of the budget of the hospital. Whether that's not sustainable, and besides that, they're emitting toxic gases into the atmosphere. So what we've done in Sierra Leone is to make a commitment to go green. Go green in the health sector, ensure we have renewable, reproducible, efficient energy for all of our health facilities, from hospitals all the way to primary health care units. And so we're very, very pleased with the partnership that we have with FCDO and the British government and engineering partners, SC for All and others, to be able to bring energy solutions, renewable energy solutions to these hospitals. So the 6 hospitals that we have are clear indications of what's possible.
Those that are currently being solarized are Kabbalah Government Hospital, where we are currently, Month, Cambia, Oladiri, ECMH, and then Masanga. All 6 of these hospitals have been completed. They've been tested, they are up, and they are running. And we just got additional funding to solarize 11 more hospitals, secondary hospitals.
I feel so elated, as you can see it from my countenance, that we are very happy with this solar installation, especially now that we can make use of the facility.
We're not saying it is because of electricity that people were dying, but you were able to make that connection, that some deaths were as a result of babies not having electricity. That some deaths were as a result of the healthcare facilities not having electricity. So you can see how lack of electricity affects mortality. So it's no brainer, to think that electricity will improve quality of care, it will improve healthcare delivery.
I'm the most excited person on earth, because I would say 70 to 80% of my worries was electricity. So imagine taking somebody 70, 80% of his worries of his life. How that person will feel so relieved. Even without work at night, I will just be around. It's like a dream for me, I'll just walk around, see the lights all over, move behind the buildings. I just feel good. So here in Kabbalah Government Hospital, I'm proud to say this is the city of lights, because we are having 24 hours electricity.
Secondly, they don't travel, it's called 20% emergency woman. Entire government is going to maternity, going to library, primary corridor, instead of the church corridors. This company be traveling. But now as I talk to you, everything will be moving. So we hope that this is going to consider it's going to reduce our mortality, it's going to improve infant survival, and I think it is all a contribution to what we want to see in Sierra Leone.
So, ladies and gentlemen, that is just part of the story. And what we're going to do now is we get editors in this form. Right? We have journalists in the print media. We have journalists in the broadcast media. And then we have IMC and we have Slash. So we get these 4 groups. What you want to do now, we're going to get some focus group discussions. Yeah? Then 4 groups there, if you know you belong to the Guild of Editors, maybe you will all get together with the president. The print media, also 1 group. The broadcast media, 1 group. And the IMC and Slash together. Let me tell me how we have owned this process of telling stories about healthcare delivery We don't want to take a very long time from now. It will just be maybe like 15 minutes. We could take this as a go. Then after which we can and report back. Can we do that? Can we do that very quickly? Abu, please. Let me organize myself. Give up editors, print media, broadcast, and sales large. Yes.
So, personally organized, I really want to know myself on this Kabbalah story. The Kabbalah story is a very powerful story, and just know which will be the whole country. But as I can remember, CMH, they get the equivalent of 300 kVA solar solution. 300 kVA solar solution. Oh yeah, this is public number. Yeah. This is public. You get 300 kVA solar solution. Yeah. You just got to see you get 100 kVA generator the whole night and day. I never get there. So when we get small incident, but you know what they go find out? So the people and they go put freezer for make cold water, they go put freezer for sell beer, or do all kinds of things inside the hospital where they get the generator for the patient. When the main lights go off now, they don't get enough power for the patient. So I think say we put immediate effort for able for oversee them program here, or do you at the big the journalists they wanna self down and help me for what say that Kabbalah hospital we see the doctor excited, the nurse excited, so we hold themselves accountable. Then they make sure say empower so now for the desired purpose and example. Again, we go all over the country, again we find them on ourselves, come and help with this monitoring. Thank you very much.
Yes, we want to just get into those groups. Let's do it quickly. Yes. Yes, please. Let's just get This is going to be a 15 session, please. 15 minutes. Yes, so